Living with type 1 diabetes. Women's sexual health. Key points. Very little is known about how diabetes affects a woman's sexuality. Decreased vaginal lubrication, leading to discomfort during intercourse, is a common complaint made by women with diabetes. Women with diabetes may get more frequent bouts of vaginitis and yeast infections. Research is underway to find answers to the kinds of sexual issues that women with diabetes face. Most research on sexual matters and diabetes has focused on male issues, the main example being impotence. Unfortunately, the findings of male-oriented research can seldom be applied to women. So there are lots of unanswered questions and uncertainty about both the cause and frequency of diabetes-related sexual problems for women. Some of the things that are known are: decreased vaginal lubrication, leading to discomfort during intercourse, is commonly reported by women with diabetes. Women with diabetes may also experience more frequent bouts of vaginitis and yeast infections. Contraceptive pills are safe for women with diabetes but may very slightly increase blood glucose levels in some women. This is usually very manageable by making slight adjustments to your diabetes medication. Women with diabetes may have a risk of infection with IUDs. Vaginitis. This is a general term for inflammation of the vagina. The vagina is the muscular canal extending from the cervix to the outside of the body. Vaginitis is often caused by a fungus. If you have this condition, you may have itching or burning and you may notice a discharge. Vaginitis is a common condition. When you have diabetes, you are more likely to get vaginitis than women who don't have diabetes. If you think you have vaginitis, visit your doctor or sexual health clinic for advice. Vaginal infections. When you have diabetes, there are times when your vaginal secretions may contain more glucose than is normal. This is usually if your blood glucose levels are high. Unfortunately, extra glucose in your vaginal secretions means that fungal or bacterial infections will thrive. This means you will be more at risk of getting these infections. Symptoms of vaginal infection are itching of the vagina and vulva, often associated with a discharge from the vagina onto your underpants. This can be treated by pessaries and creams. Occasionally, a course of tablets taken by mouth by both you and your sexual partner is also needed. If your blood glucose levels are high, bringing them into a more healthy range will help. Contraception. When you have diabetes, it is very important that you plan your pregnancies. This is because conceiving a child during a period when your blood glucose levels are very high puts that child much more at risk of developing a malformation. Planning a pregnancy should be done well in advance, so as to work on improving your blood glucose levels for the period around conception and pregnancy. For this reason, contraception is an important issue for women with diabetes. You should choose a form of contraception that is safe and effective and try hard not to take any risks. Visit your doctor for advice immediately if you have had unprotected sex. The risks associated with taking the oral contraceptive pill are the same for women with diabetes as those without diabetes. Although some women do experience a slight increase in their blood glucose levels when they first start using this method of contraception. If this happens, you can usually manage it very successfully by a slight increase in your diabetes medications. Having an intrauterine device, IUD, may lead to infections. Because you are already at a higher risk of getting infections by having diabetes, it is probably best not to choose this form of contraception. What's an IUD? An IUD is a device inserted into the uterus womb to prevent conception, pregnancy. The IUD can be a coil, loop, triangle, or T in shape made of plastic or metal. How IUDs prevent pregnancy is not entirely clear. They seem to prevent sperm and eggs from meeting by either immobilizing the sperm on their way to the fallopian tubes or by changing the lining of the womb so the fertilized egg cannot implant in it.